So a patient in their first visit should expect compassion. They should expect understanding and empathy.
Most important thing is to see them as fellow human beings. Our job is to try and make it as easy for the patient, as comfortable for the patient.
And for that reason, I think that's what makes us ahead of the game.
Something of this magnitude in a small town, you get the best of both worlds.
I think our job is to say, yes, we're a large institution, this is what we offer, but we want you to feel like you have personalized care and you're not treated like a number.
I think I'm proud of just being a part of something that is growing, and I know we're giving excellent care and it's close to home.
Patients should know that when they come here for treatment, we are going to work incredibly hard to restore their health and get them back to where they were before cancer started.
West Virginia University cares about the health of the citizens of its state. We make sure that we strive to provide the most advanced, best care possible.
We do a variety of procedures. We do some things that are small that myself, the residents or fellows are able to complete, such as the bone marrow biopsies, skin punch biopsies, or intrathecal chemotherapy.
In the last year and a half, we have started CAR T, and we've also started photophoresis, which are both the only in the state of West Virginia. And so we become a hub for patients within the state to come get care within the state for those two.
Clinical trials are obviously the cutting edge of treatment, and an ethically, correctly chosen clinical trial is always the right treatment for any patient with cancer.
I helped to start our cord blood program about 10 years ago here at WVU. And cord blood has made a big advancements using umbilical cords as the stem cell source for the bone marrow transplant.
Many groups are expanding the work they do, in particular with advanced robotic surgery, speed up recovery time, use small incisions, just overall enhance the ability for a person to get back to their full function after these operations, which can be quite hard on them initially.
And not only are clinical trials great for the patient because it allows them a second team of research staff, but they're also helping future generation of women who are diagnosed with the same disease that they have.
That was a big step in offering things to the state of West Virginia that were not available to them in the past.
I think being an oncologist has really shaped my perspective on life.
I chose oncology specifically because my mom had passed away from lung cancer, and she had an excellent oncologist and team that really took care of her. That special bond, I mean, there's nothing like it. There's nothing more rewarding, and I knew that this would be my path.
Every single time they will ring that bell and they will turn around and they are just so appreciative of what we did for them through this whole journey. And it is just like a feeling that I can't get enough of.
I actually took some time where I did not work in oncology and I missed it. So I was happy to come back and start at the Cancer Center.
It's not just doing their surgery and never knowing how they turn out. It's not just doing their chemo and seeing them only if their cancer comes back. I get to see them from the beginning when they're the most scared to the end when we're the most thrilled. And I get to see them off to the next phase of their life.
You can tell we love our job by, the care that we give.
I love helping to tailor their regimens. I love seeing good outcomes. I love seeing the patients doing well.
And that's not speaking for me, that's speaking for my whole team.
And it's not the recognition that I need, it's knowing that I made an impact in someone's life.
I can't imagine myself going anywhere else, and I can't imagine practicing anywhere else because of that passion for the people in the state.